Is it important to care about patient satisfaction and reviews? Is it really what we need to focus upon? Now, this is a very important topic when we talk about physician effectiveness. And here we are in the physician effectiveness series. I'm Dr. Mike Marcos. I'm an endocrinologist practicing in Indiana. And today I would like to touch on this topic, which is really crucial. And the crucial part is, although it is very important, we don't get to learn a whole lot about that during our training. We get to focus on learning the medicine, which is very important, but there are some aspects around practicing medicine that we need to focus upon. Where is the dilemma? Now, we want to practice good medicine. We want to achieve good outcomes. And we want to reach a middle ground between getting that medicine job done, which is important, to have the patients happy, which is also important, and then achieving a reasonable revenue for us as physicians. This is also important for us. We need to find the balance because you have an agenda and there are things you need to tackle and to discuss with the patient. And during that time, you want the patient to be pleased as well, and you truly care about their emotions and you attend to what they need. And this takes time. And the more time you spend in the visit with the patient, the fewer patients you will see, which will decrease your revenue. And I'm not asking that we see tons of patients every day, but it is just simple calculation. If you spend a lot of time with every patient, then you will see less number of patients. And the volume is a huge part of our revenue. So how can you achieve all of them within reason? Your patients are really pleased and happy, and the duration you spend with the patients is not much, so you can see more patients and achieve good revenue. And still, these patients will recommend their family members, their friends, and they're going to write you good reviews. How can we achieve that? The first question we want to ask is patient satisfaction important? In order to answer this question, you need to understand the balance between the cerebral cortex and the limbic system, the reasonable mindset in making decisions, and the emotions that play a role in the decision making. And it's a very interesting fight because every time there is a fight between the cortex and the emotions in the limbic system will win. If the physician is such a great physician who everyone gonna talk about their skill and expertise, but they have horrible bedside manners, chances are they're gonna get bad reviews, although they are great clinicians and they get the job done, because emotions play a big role in our decision making. On the other hand, some patients decide to go to the same physicians over and over, although they are not reaching a good outcome, just because they like these physicians and they like the encounters. I'm not saying that I'm generalizing that on all of the patients. This is not the case. If me as a patient, I have a very nice physician, but they are not achieving the outcome that I would like to reach, chances are I'm going to go to another pleasant clinician. But if there is a clinician who is very competent, but they are not very pleasant, I may decide not to go there unless they are the sole experts in that specific field, and then I'm stuck and I don't have another option, which is rare. It is not the common scenario. So the point here is understand that emotions play a big role in our decision making. This is very important to understand. The second is how patients choose their physicians. Reviews and word of mouth play a big role here. Again, if I am the patient, how can I tell which physician I'm going to choose for a specific disease? First, I'm going to ask my friends or those who I trust. And if I cannot find, I'm going to go to the online reviews. And I'll do my best to go to unbiased patient reviews. So chances are I may not rely 100% on the reviews written on their website, because chances are they're going to be biased. I'm going to go to Google or Google Maps or other websites where patients can share their reviews without monitoring, with the understanding that usually those who write reviews are on the extremes. Either they had a phenomenal outcome and they would like to write about it, or more commonly, patients who had negative experiences and sharing that. And they may not represent the real situation. These are usually the populations of patients who share their reviews. Moving to the next point, as a patient, how would you like your physician to treat you? First, you want undivided attention. If I'm sitting with the physician, but then they are looking at their computer all the time, they are not focusing on me, they are not maintaining eye contact, I'm going to feel that they are not listening to me and I'm not that important to them. And I will not be pleased here. Second, is that the physician is approachable and pleasant. I can feel comfortable talking to them, share my vulnerabilities, and trust their expertise and opinion. This is going to be much easier if there is that common ground of having nice communication skills to be able to talk to them. Next is mastering their medicine. You can tell when you are sitting with a physician if they have the expertise and they treated diseases like the disease, if I'm the patient that I'm talking to them about, whether from how many patients they treated before, from the advice, and sharing the logic in how they are thinking. It is very important for me to trust in their skills. And of course, this is during one visit, but then from the subsequent visits, you can tell if we are reaching a good outcome or not. And last but not least is excellent communication skills. Even if I'm saying good enough communication skills that can let us go by. As we talked before about the 20-80 rule, 20% of the effort can give you 80% of the outcome. And sometimes 80% is good enough. So if I have the foundations of communication skills, I can fly by. I don't want to get 100% on communication skills at the expense of others, but we need good enough communication skills. As we are in a world dominated by reviews, and we as physicians now are competing with the restaurants and medical spas who go by the reviews, it's just a very different world we are living in and a change in the mindset. We need to care about the reviews. And it has to be among our priority list. We cannot dismiss them and say, you know what, I'll just practice good medicine and I don't need to care about that. You can do this if you have a huge patient load and you truly don't mind, even if negative reviews, you're still gonna have a full panel. But I'm gonna say, even if this is the case, I would recommend that you care about your reputation, because whatever you have today may be challenged tomorrow. Today you are dominating your market. There is no one else except you. Tomorrow you got competitors and these negative reviews gonna come back and bite you. So care about the reviews and work on them. A very important question that is being asked before we talk about the positive reviews is how to deal with the negative comments and negative reviews. And my advice for you here is make them a minority. The solution is dilution. If you have 2 reviews and 1 is negative, that's not good. This is like 50%. But if you have 100 reviews and 2 of them are negative, this is 2%. This is now a minority. This minority will be very important because it shows that the 98% of the comments are authentic. They are real, because if you are making them up, you will not put negative comments. So negative comments are important, but you need to dilute them by getting a lot of positive, authentic reviews. Now let's talk about some tips to help you in achieving good patient satisfaction. Number 1, maintain eye contact. When you are talking to the patient, ensure that you are looking in their eyes and maximize that time where you are keeping eye contact. The more eye contact means the more you are focused and the better you are at understanding them. This is how they perceive it. Second is go where the money is. Focus on the important things and focus on the important things from the very beginning. The important question is, should you focus on the important thing for you as the physician, which you think is the most important, or focus on the most important thing for the patient, which is what they perceive as the most important? And sometimes there is a big discrepancy here. Maybe the patient's biggest problem is the transportation, but your biggest problem is their uncontrolled diabetes leading to a diabetic foot infection and they may lose their foot. My suggestion for you, focus on the most important thing to the patient first and get it out of the way. And then you focus on what you really think is important and that you need to tackle. And that's why it is a very good thing to start the visit by saying, what is most important for you today? What do you want me to focus upon? So that you get what they need, you time your visit accordingly, and you know the sequence, how you're going to tackle it. Or ask, do you have any other questions for me today? You don't want to overwhelm yourself. And if the patient has a lot of issues, that's okay. We should not have our perfectionist part taking over our practice. And sometimes I can tackle one thing with the patient today, get them back in a couple of weeks, focus on some more. Like if I'm seeing a patient for diabetes and they say, you know what, I also got diagnosed with osteoporosis, and can you help me with that? I'm going to say, absolutely, I'll be more than happy to help you with that. Let me order the blood work and let's discuss it in a couple of weeks. So you are taking care of the patient, you are attending to all of their needs, and also maintaining my workflow going. So within few months, all of their issues are taken care of, and my workflow is going as well. To sum up here, patient satisfaction and reviews are very important, and you need to care about them and have them as part of your routine practice, and ensure that good communication skills are being followed all the time. And thank you for watching.